Welcome back, everyone, to today's Explainer. Today, we're going to look really closely at a procedure that happens literally millions of times a day, yet carries incredibly high stakes if it's not done exactly right. We're talking about mastering the blood draw. We'll be walking through a complete chronological patient encounter, breaking down the top mistakes that healthcare professionals make, and showing you exactly how to avoid them. Let's get started. Have you ever looked at your arm after what was supposed to be a totally routine blood draw and wondered why it bruised into this massive, dark, beautiful hematoma? It's an all too common and honestly pretty painful outcome for patients. Well, today we're pulling back the curtain. We are uncovering the hidden, behind-the-scenes mechanical and procedural mistakes that actually cause those nasty bruises, and frankly, a whole lot of other hidden lab errors. Okay, let's dive right into this. Here is our roadmap for today. 1. Pre-draw prep pitfalls. 2. Nailing the vein insertion. 3. Tourniquets, tubes, and timing. And 4. Post-draw patient care. Starting off with Section 1, Pre-draw prep pitfalls, setting the stage for success. For years, right? Healthcare workers had it totally drilled into their heads to clean the draw site using an old-school method. You know the one, concentric circles, starting in the middle and slowly working your way outward. But recently, a somewhat controversial new school method has popped up, which is back and forth friction. Basically, you take that alcohol pad and you really rub it back and forth to scrub away and kill the germs. Because the medical field is still a little bit divided on this shift, the absolute best practice is to just neutrally follow whatever specific protocols your facility mandates. Now, once you do clean that site, you immediately hit the next massive pitfall, waiting 30 to 60 seconds to let the site dry. And look, we completely empathize with healthcare workers on this one. When you're slammed, running from room to room, awkwardly standing there staring at an arm for 60 seconds while alcohol air dries, it feels like an absolute eternity. But there is a vital, non-negotiable purpose for that wait. You have to give the alcohol the necessary time to actually annihilate the germs on the skin. You simply cannot rush the clock. Which, of course, leads us right into the classic inner monologue of a busy phlebotomist. Okay, I think I forgot exactly where that vein is. Let me just touch it one more time. Actually, don't do that. That is a major, major error. Think about it for a second. You just spent a whole minute awkwardly letting that site perfectly dry and disinfect. The moment you touch it again with your gloved finger to repalpate the vein, you instantly contaminate the site all over again. Always remember this golden rule. Once you've cleaned it, it is completely off limits. No more touching. Moving right along, we arrive at Section 2. Nailing the vein insertion, the critical stick. So let's look at how we manage the patient during the stick itself, specifically what they were doing with their hand. We have some very clear do-nots when it comes to fists. You absolutely do not want the patient repeatedly opening and closing their fist, like they're vigorously pumping an invisible hand grip. No way. You also do not want them holding a tight white knuckle fist throughout the whole procedure. Instead, you just want to ask for a gentle, light fist. And crucially, you need them to release that fist the very moment you get blood flow established. But why does a simple fist matter so much? Well, when a patient aggressively pumps their fist or squeezes too tight, it can cause something called hemoconcentration. Basically, this is an alteration in the lab results that directly causes skewed readings for things like potassium and hematocrit, which is just the ratio of red blood cells to the fluid in your blood. So all of a sudden, a mechanical mistake you made with the patient's hand has completely ruined the accuracy of their blood test. Now, as the needle actually goes in, we reach a really vital step called seating the needle. A super common mistake is inserting the needle, seeing that initial satisfying flash of blood that tells you, hey, I hit the vein, and then immediately popping the collection tubes on. You really can't do that. You have to be methodical. Step 1, insert to get the flash. Step 2, gently lower the angle of your needle. Step 3, advance it in just slightly more. We're talking maybe the thickness of a nickel. This perfectly secures, or seats, the needle inside the vein. If you fail to take that tiny extra step to seat the needle, you risk collapsing the vein entirely or causing hemolysis. Hemolysis is literally the destruction of the red blood cells as they're being drawn out. If those cells are destroyed just because the needle wasn't securely seated, the lab sample is completely ruined. And unfortunately for everyone involved, that patient is going to have to be stuck all over again. All right, that brings us to Section 3, tourniquets, tubes, and timing, managing the flow. The crucial number here is 1, as in 1 minute. You literally cannot leave a tourniquet on an arm for more than 1 single minute.
Just like the fist pumping we talked about earlier, leaving a tourniquet on too long acts like a dam, causing that dangerous hemoconcentration that drastically alters the lab results. So the absolute best practice? The second you stick the patient and establish blood flow, you go ahead and pop that tourniquet right off.
Now, let's talk about the specific equipment you're using. If you're following facility protocols and using a winged butterfly blood collection set, you have to be incredibly careful. Why exactly do winged butterfly sets require a waste tube? It's a really fantastic question, and it points to a very hidden danger. Think about the physical design of a winged butterfly set for a second. It has that long, clear tubing line. When you first start the draw, that entire long tube is just full of air. If you just pop on your first real collection tube, let's say a sodium citrate tube, all of that trapped air gets pushed right into the vial before the actual blood even makes it there. That invisible burst of air completely throws off the highly specific, protocol-mandated blood-to-additive chemical ratio inside the tube. So you absolutely must attach a waste tube first, just to clear the air out of the line, discard it, and then pop on your actual collection tube. And speaking of popping on tubes, it would be wonderfully easy if we could just draw blood and pop on whichever pretty colored tube we happen to grab first out of the bin, right? No way. Absolutely not. The order of draw is completely non-negotiable. Different colored tubes contain completely different chemical additives. If you don't follow the specific, required order, you risk dangerously cross-contaminating one tube's additive into the next, which entirely voids the accuracy of those blood panels. And finally, we reach Section 4, Post-Draw Patient Care. Finishing strong. Because just because the needle is out of the arm does not mean your job is over. The biggest mistake at the very end of a procedure is rushing the exit. You really have to take the time to sit there and hold good, firm pressure on the puncture site. If you just slap a piece of gauze and a bandage on and quickly walk away, that blood is going to leak straight out of the vein and pull right into the surrounding tissue. And what does that cause? Yep, it causes that beautiful, painful hematoma we talked about at the very beginning of this explainer. And keep in mind, this step requires even more diligence depending on your patient's medical background. Extra caution and extended pressure are absolutely critical for patients taking anticoagulants or blood thinners. They are naturally going to bleed for a significantly longer time. And honestly, a lot of patients don't really understand this or realize what can happen beneath the skin if they bend their arm too early. It is your job to sit there, patiently hold that good, firm pressure, and educate them on exactly why you're taking that extra time to care for them. So, I'll leave you with this final thought. The next time you, or maybe someone you know, gets a blood draw and ends up with a nasty bruise or a mysteriously rejected lab sample, well, you know exactly which of these critical behind-the-scenes steps was skipped. Whether it was a vigorously pumped fist, a missed seating angle, an overtime tourniquet, or skipped pressure at the very end, you now have the structured knowledge to understand exactly what makes or breaks a perfect blood draw. Thanks for joining me for this explainer, and keep learning.